So over the past year, VQI has reached several milestones. We've gone over 1,000 centers that participate. We now have over 1 million procedures that are entered into the registry, and we have over, and this has been over 10 years. It's now our 11 years. So there's a lot of us to sort of recognize and celebrate. And it's muchly due to folks such as yourselves who engage, who work on quality charters, from our many volunteers who spend a lot of hours of their own free time working on it. We'd now like to bring up to the podium the group from Jobst Vascular, and they're going to tell us about their 10 years of participation, their experience with 10 years of participation in the VQI. And we're going to have them provide us with a story of ProMedica's 10 years of participation in VQI and their single systems experience. Welcome.
Thank you. Good afternoon. Thanks for having us today. My name is Robin Acino from Jobst Vascular Institute at ProMedica Toledo Hospital, and I'm here to present on our 10 years of experience. So 2022 marked our 10th year that Jobst Vascular has participated in the VQI. And the purpose of our review today is really just to kind of highlight our journey and what we have done with VQI and the impact that our participation has had not only on our system, our patients, but also on our overall clinical practice. I don't think we're necessarily unique in what we've done, but it has been pretty fun to take a look back at all that we've done in the past 10 years. So I have had the benefit of being involved with VQI from the start. I was our original primary data abstractor and the primary data manager. Initially, our focus was really specifically just on the quality aspect and solely centered around quality. As we got more involved, we quickly realized the value this platform provided, not only to quality, but far beyond. It enabled us to easily develop and participate in multiple QI projects, many small, just internal projects that we did that came out from our clinical results and/or on other ideas based on what physicians had encountered in their daily clinical practice. Additionally, the ability to tap into our data supports our team's investigator-initiated research, as well as a lot of prep work that is needed when we look and consider potential sponsored research studies. Last, we've expanded our efforts to help support our medical students, our medical learners, and also our residents and fellows, as it's given us the ability to provide those residents and fellows specific feedback on cases and outcomes where they have been involved. In 2023, we began participating in just 2 carotid modules, abstracting just under 120 procedures that year. Through the years, we have added modules as well as stopped participation in others. In total, over 10 years, we've abstracted over 5,700 index procedures across 11 different modules, and that now makes up our database from Jobst. That does not include any long-term follow-up or 30-day follow-up. If you consider that, it probably triples that number at least. In 2023, we did add another new module, bringing our active total to 10 modules that we're currently participating in 23. And that equals about over 1,000 procedures annually. So monitoring quality has been, of course, the largest role, as you would expect. We felt that VQI was better than NSQIP and leveraged the approach that VQI takes 100% of cases in their system to implement that as our quality platform for all of vascular across our entire system. As part of our service line and the goal to monitor readmissions, we hardwired the expectation for abstraction for 30-day follow-up and began to report on it many years ago. This data serves as a part of a weekly summary that is compiled from our data and analytics engine to run reports for volumes, complications, and 30-day readmits. And it's sent to our entire provider group on a weekly basis by Julie, our abstractor. Quarterly, we compile our data and present to our entire team, including hospital administration, and it highlights our data along with regional and our dashboard data reports. And we be sure to call out where we have exceeded or fallen short of both regional and national measures. Many times, the discussions that are generated from seeing ourselves compared to regional and national partners results in deeper dives and small quality improvement projects into those areas of opportunity. The data sets are a treasure trove when looking for trends, causes. We've used it for cost analysis and best practices amongst different providers or within different procedures. As our experience grew, the scope expanded to include the two pillars of the mission of JOBST, clinical research and fellowship training. A generous gift was provided to Toledo Hospital in the late 1980s that established the JOBST Vascular Center. And part of the center's structure is a dedicated clinical research department, and we have 2 fellowship training programs for vascular surgery and vascular medicine. Under the guidance of Dr. Fedor-Lurie, our research team splits their time on both sponsored studies and investigator-initiated studies. The robust data sets that are accessible from data downloads provide a huge opportunity for homegrown research. Tapping into regional and national data via arterial and venous rack requests has also provided us the opportunity to do larger scale projects. This data saves valuable time, has a strong integrity because of the defined responses, and is much more user-friendly than trying to glean data out of Epic. To date, data from VQI has been used for over 30 projects, including 10 poster and podium presentations here at VQI. As part of our fellowship training, we've used VQI to assist in tracking volume and quality metrics specific to our fellow and resident cases, provide case details to support M&M conferences, which we have on a weekly basis, and it also serves as a platform to improve documentation. It's very easy to see when information is missing and when we've had to require cases as a submission without validation. We've used it to tie it back to specific providers and their documentation templates, and we've been reviewing the data as a useful guide to help track improvements within our fellows as part of their milestones evaluations. It's been useful to show areas of opportunity and track improvements over their training periods. Unforeseen benefits that we've discovered along the way were hugely impactful to our practice. First, as we transitioned to Epic in 2016, the conversion from the Acino office platform to Epic did not go as planned, and we ended up losing all of our patient recall lists. As you can imagine, it was a very large number of patients where we no longer had access to their information. What we did do was utilize our VQI data to identify those patients who at that time were only in our carotid and AAA modules, but we were able to engage them back into the practice. Similarly, we've used VQI frequently to review and track patients for longer-term outcomes, where it's best practice to maintain surveillance, and the database has come useful as of late for some FDA device recalls that we've been queried for. Similar to what Donna presented on yesterday, following claims validations in 2017 and 21, we also identified incorrect coding and billing between 12.5% in 2017 and 10.1% of cases in 2021. It has led our HIM team to reevaluate the auto-suggest indicators for key procedures and implemented a mandatory review of certain procedures that have a person review them to ensure correct coding. We've also provided specific educational sessions for coding staff to help improve their understanding of terms that led to the mistakes and incorrect procedures. We still obviously have work to do. Last, as an accredited, IAC-accredited vein center, participation in the varicose vein module has proven to be very beneficial for us. It's to help support our reaccreditation, compliance, and reporting. The data collected in the vein module is very closely correlated with reports, and it also provides a simple way for us to select cases for auditing at times of renewal. Some of our biggest lessons learned have been highlighted previously on how we incorporated VQI into our institution, but through the years we've made changes to modules mainly based on the ability to monitor outcomes and to improve clinical practice. In one case, procedure volumes decreased to 1/3 of previous years, and that drove the decision to change out that module and add one with higher volumes to give us a greater opportunity to improve our quality. With another module, we struggled to find complete data, specifically on the follow-up requirements, leaving many records incomplete. That, coupled with key outcomes that were of interest to our team were lacking, caused us to stop participation because it just wasn't meeting our needs. The positives that we enjoy is the flexibility the notes section creates. We've added information for additional analysis and reporting. We use the section frequently, noting initials of the abstractors, fellow and residents on the cases, monitor learner-specific quality metrics, and specific details on complications, notes for follow-up, and also any details for their readmissions. When downloading these data sets with this detail, it makes it very easy to create additional columns for data analysis and customized reporting. A few key components to our success is the support from our C-suite and our service line leadership, engagement from the physicians, and a full-time on-staff abstractor. Recognition by leadership of the value add that VQI provides to our overall vascular service line is appreciated for the internal reporting capabilities, as well as the national reports and dashboards that showcase our center versus regional and national data. Physician engagement has gained over the years, specific to their personal and center-level data outcomes and the role their documentation plays in the accuracy and analysis. Finally, the benefits of having a dedicated full-time internal team members abstracting our own data has provided us the ability to collect and confirm information, provides timely notification for mortality and morbidity, and results in frequent analysis to support preparatory for research work, quick volumes or metric queries, and many things to support additional clinical operations. The role that Julie provides to us really is truly invaluable for keeping our data up to date and timely, and she's probably solely responsible for ensuring our one-year follow-up has routinely exceeded 90%. We take pride that our center has received a 3-star award now 7 times, and it's a testament to our staff and the commitment of our institution to the VQI. That's all I have today. Thank you.
Thanks very much, Robin. That's certainly a very impressive report. Before you walk by that microphone, I just wanted to ask you, certainly by this large number of registry participation and the expense of data entry, that's quite an expense that your institution has incurred. And can you tell us a little bit more about how you've engaged your leadership to support this effort and the value it's brought to them?
Well, I think the one thing that has been beneficial for us from our team is that we put it to use. I think being that we've been able to show continuous improvement in our quality and show the value it has to see where we stand versus the region and national has been a good testament to the investment to participate in VQI. Certainly our endowment from our foundation is helpful. It does help offset some of those costs, but at one point we were approached many years ago about outsourcing our data entry and data collection, and I think I put a 4-page dissertation together about why we needed to keep that in-house, and it very quickly was turned around, and they agreed to keep our staff in-house doing that piece because they saw the value. I think having somebody like Julie, that's her full-time role, and she has her thumb on the pulse of what's happening in our system, provides way more benefit to us to be able to be on top of our quality overall.
Very good. Great.
Robin, we have an online question for you.
Oh, sure.
With 10 years of participating in VQI, what is your abstractor to registry ratio?
We basically have one full-time person. It's Julie, who's with us today. And she will tap into our other research coordinator staff to help her on specific projects. If she gets behind on long-term follow-up or has specific things, she basically asks for help. So it's 1.25 maybe to 1, if you would say. 1.5, 1.25 FTEs, I would say, globally.
Thank you. So I'm just going to reiterate that for Sylvia online. So it's 1.25 FTEs. Thank you.
Okay, thanks.
We did just about 1,000 this past year, and we added another module with the roughly 1,200 is what we'll see this year.
Robin, I'm so sorry. Would you mind saying that into the microphone for the online?
Yep, the question was how many annual cases do we abstract annually? And last year we did just over 1,000, and we expect to be about 1,200 this year.
Okay, thanks again.
Thank you.